And one of the things I have to mention patients with PCOS mainly deal with is infertility and or difficult conception. And what we found is that these medications, just because you lose weight, then you're predisposed to getting, babies. And so you'll hear Ozempic babies, people who...
Is that a thing?
It is a thing.
Yeah, I heard that. Okay.
Treatment of obesity, like I said, 4 pillars, only starts on your plate. 60% is actually nutrition. But now it's no longer eat less. It's what are you eating? Okay, and especially if you're on GLP-1s, we found that people are sub-eating, especially protein, and so you get like these Ozempic faces. You've seen that because you've lost so much muscle around your face. So you really have to up your protein. Exercise, like we said, every single day, and I say at least 5 days a week, both strength and cardio, or aerobic, and then sleep, stress, and then if indicated, then GLP-1s are here to save us, I have to say. Indications of getting on the GLP-1s medication. I know there are other medications for obesity, but let's focus on the GLP-1s. And this is like semaglutide, which is otherwise known as Ozempic, or tirzepatide or Mounjaro, and others are coming. So the absolute indication is if you have a BMI above 30, or if you have a BMI above 27 with other conditions. And these other conditions are like high blood pressure, diabetes, heart disease. So that is the indication. So if you come to me and your BMI is around 25, I probably will not recommend the medication because you don't meet that criteria. But if your BMI is above 30, then you're indicated to getting on these GLP-1s. But of note is, we don't do that in isolation. Exercise, nutrition has to go fast. And so when you come in, I'll be like,
has to go fast.
Has to go fast in the sense that we do optimized nutrition, we do optimized exercise. We're able to track and see what can your body do with just intensive lifestyle. And then after that, after a month, then you come in and we see, then we're like, okay, can we attempt these tools? So GLP-1s or any other medications are just a tool to help you, because then even after we are done, the lifestyle is what really maintains.
Okay. And what does being done look like? Is it 2 years? Is it 1 year? What does that look like? Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough information to help you make an informed decision. My name is Dr. Hope. I am the host here, and I have 2 lovely guests, and we'll be talking about something so interesting, but something we've been seeing and hearing a lot about over the past couple of months to years. So before I introduce them, this is that moment where I invite you to subscribe. Please take a minute, push that button, select it, subscribe. Thank you so much. Now, let me just go straight to the guests in the room. So you can introduce yourselves 1, 2 in that order.
Hi, my name is Dr. Caroline Mithi. I'm an endocrinologist and physician and obesity medicine specialist, CEO and founder of Evolve Well Healthcare, which is a
wellness
center. That we deal with everything lifestyle, obesity, and any other hormonal disorders.
Okay. I didn't know there's obesity specialists. I'm learning now. Even you?
Same.
Go ahead. You can reintroduce yourself.
I'm Lily Aiysha. I'm glad to be back. I'm just here. I don't have as many positions as she has in this country, but I'm here because I want to learn from her. So thank you for having me, Hope.
Yeah. Karibuni sana. And let's just start. How are you guys feeling? A journey to Inside Out. Mko wapi mentally, emotionally right now?
Mentally, I'm actually doing very well. Emotionally, I'm so happy. We've been laughing before this. So yeah, mi nakwanga tu sawa by the way. Yeah, I think I'm doing well.
Okay. What about you, Doc?
Excited to be here. First time on the podcast, like I've said. So really excited.
Okay. I'm excited to have the both of you and for this conversation in particular. Now, I usually have a segment where it's the doctor's seat or the patient's seat. Now I have a doctor and I don't want to call you a patient. Today you're not a patient.
I'm not a patient.
So what we'll do is I'll have the doctor's seat and Dr. Carol will answer. And we'll chime in where we can, yeah? Okay. So the first question is, if you were to explain to a 4-year-old what you do, how would you do it in 2 sentences?
4-year-old, that's like my son. in the practice of making people well again.
Okay. Oh, that's simple and
That's
nice.
yeah.
Yeah. Okay. I hope I'm a shika by the way. Tell him to watch that
Yes,
segment.
Z1.
Okay. Then the next question is, if you were to rate your top 5 medical specialties, which ones would they be and why?
Specialties, of course, obesity medicine,
Okay.
just because it's a new field
Yeah.
in medicine.
Mm-hmm.
Endocrinology and diabetes, and then internal medicine, pediatrics, that's children. The other one I probably do is public health,
Okay.
just because it's chilled, it's easy. But I really enjoy patient care. So anything with patient care, patient interaction, I love it.
Okay. Hey, as we are public health here.
Yeah.
Okay, then the next question is, and I think I'll ask you, Lily, again today.
I hope I'm ready. Last time I was just humble. Let's go.
This one question you can both answer.
Yeah.
If you want a grant today, is it changing? Your answer can change, by the way. Maybe your position has changed. But if you want a grant today, what problem are you solving?
I go first.
Yeah.
Obesity and weight management. Like you can tell that is so close to my heart.
Yeah.
But that really is what. And I'd call it malnutrition. And now malnutrition is both underweight and overweight. So in summary, I'd actually sort out obesity and malnutrition.
Okay. That's an important tick, by the way. It's both overweight and underweight.
Yeah.
Okay. What about you, Lily? Are you changing your answer?
No, that time I don't remember what I said, but I still believe I'd add practitioners. That's what I said.
Yeah.
Yeah, I think I'd do that.
Okay.
Especially in public. Okay, I felt so bad last time I said out of privilege. I was just like, I went home thinking, these people just think this girl. But no, like I'd still want, especially for public hospitals.
Yeah.
Even meds and equipment. I don't know what they're called. They're called equipment. They're called
Resources.
equipment.
Just call them
Resources.
Yeah.
I'd add on that so that everyone can just get equal health care.
Access.
The English people are here.
So next question. What's the one skill or habit that you think makes you a good doctor?
Empathy and listening. Yeah. I'd listen to you till.
Yeah.
That's why I enjoy your podcast, really.
Oh, thank you. Thank you.
So empathy and listening skills.
Yeah. Lily, do you think
That's
I'm a good
so
listener?
important. Yes. And you asked me this and you already told you. Hope.
No, I'm asking because we're in high school together.
Yeah, actually she is a good listener. But I never imagined Hope doing this ever. So even just her listening to you and like it doesn't matter even the stupid questions you ask, she listens. So
I actually believe there's no dumb question.
I love it.
agree.
Yeah, there's no dumb question. So please don't ever feel like you're asking a dumb question.
Ask it.
Yes. Yeah, but they're dumb people. And we'll stop there. Now, ya mwisho, because episodes go up on Wednesdays. So, Swahili Wednesday. Ukitumia lugha ya taifa, eleza mada ya leo na dalili moja ya hilo mada.
Oh.
Nimekupoteza?
Mada ya leo ni kuhusu mwili. Na dalili. Dalili ni?
Symptom,
Sign.
like one sign or symptom.
Ugonjwa wa kukula sana.
Okay. You've tried.
Ugonjwa kukula sana kwa kizungu ni what's that in English?
Overeating.
Overeating.
Damn.
It's one of one symptom.
All right. Now let's bring it back to the conversation. So why we're here is because over the past couple of months and years, there's been a lot of talk about weight loss, but we want to talk about weight management today. And right off the bat, I just want to find out what has been your weight journey. Maybe we can start from Lily. What has been your weight journey?
Hey, I cannot imagine a day that I was small.
Okay.
Like I think since you've said you're in high school together and you have friends who are with in primary, I'm just gonna say it. I had boobs when I was like in class 5. Like I've always been a big chick.
Yeah.
And when I got pregnant is when of course I added more weight. And that's the time I can say for the first time in my life, I lost weight and I said, wow, I can lose weight now after pregnancy. But then I got to learn that's what I ate and I was like, damn. Oh well.
Still.
Yeah. So I think that's been I've just been a big girl all the time.
Yeah.
Always. Yeah.
Okay. What about for you, Doc?
Interestingly, I've always been a small person. And I usually joke and say, up until I got married, like I really struggled to get my wedding gown. That's how small I was. I was like 40. And then pregnancies came and I gained a whole 30 kgs, and so that's when now I was like, oh my gosh, this is what it feels like. And so it's now from, my 2 successive children, it's been now a journey into not getting back to the 40s, but now really just being aware that hormones have come into play, pregnancy, time, the older you get. So really just being in that journey of weight management as opposed to weight loss, just to be healthy. And this is an ongoing journey for every woman, for every person, however small you are or big you are, there'll always be changes. And that's why we're here to say, even as the changes come, then we're able to work because they're pleasant, seasons in that case. So I've gone from being very small to being very big to now trying to manage the weight.
Okay. Me, I've always been small. I thought I couldn't otherwise, by the way. And I used to hate that thing for when people wrap their palm around your wrist, because it just like, oh my gosh, you're so small. I never used to like that, and I used to want to add weight. Oh my goodness, adding weight has been my life's journey. Honestly, I've never passed 55.
Wow.
I've never in my life. But then also just what you're saying about pregnancy, like looking at my mom, I know it's something that if you get pregnant, I have the potential to add weight. But I always used to want to add weight. And then now it's like being small is back. It's the in thing. So has that changed anything for you, especially Lily, because you said you've always been big? Has that changed anything for you? Have you wanted to like now lose weight more, or through medication or other options rather than like working out and
I mean, definitely.
You've thought about it?
Yeah, I've thought about like for real. If I had money, I keep telling even my friends, if I had money,
ungekuwa hapo?
yeah, I'd have been that. Those quick ones, yeah. But usually say maybe those quick ones, because am I allowed to mention them?
Yeah, you can.
Oh, I'd do like the Ozempic, the Monjaro things for quick, but for a short time, just to jumpstart to see if maybe for real I have the potential of really losing weight, because I don't know. Like I've done gym, we've seen I've go to the gym. There's a time I was on the NAS program and I did like, for some time I've eaten boiled food. Even when I was sick, I was just eating the boiled food. But still, I won't tell you that significantly I've lost 10 kgs, like I'd maybe lose 2 or 1 or 3 hata nikienda sana, but after pregnancy is when I lost like 8, and I was like, wow. But you see now, I came back to who I was before pregnancy.
Kidogo tu,
Get pregnant.
one hip.
Get pregnant.
On that note.
Yeah.
That's interesting. Doc, what's your take on now this whole agenda of the weight loss management in terms of medication? Are you seeing it being more common? Are you advocating for it yourself? But how do you go around it?
So it comes down to knowing and acknowledging that now obesity is a disease classified by the WHO and all other organizations. And being a disease, we call it a chronic relapsing progressive illness. So chronic meaning it's like diabetes, high blood pressure. Relapsing means you will oscillate, just like you say, you'll oscillate between, your body always wants to go back to its comfortable weight. And then progressive meaning that it's ongoing. So once you realize that obesity is a disease, then like any other disease, then we have medications for them. So when you approach it like that, hence we say that now the GLP-1s medication, they're God-sent in a sense. It's like the drug that keeps on giving. And no, for sure. And that's because for like 100 years, approximately 90 years, we've not had anything for obesity. And so we even didn't classify it as a disease, because you classify it as a disease, but there's no medication, know. But now once, and that was like 10 years back when our first GLPs came, and we're like, my gosh, it's a disease, let's treat it. And so for us, it is that silver bullet, and it's an amazing drug, I have to say, if used well.
The last part,
if used correctly.
Now what is using it correctly?
So indications of getting on the GLP-1s medication. I know there are other medications for obesity, but let's focus on the GLP-1s. And this is like semaglutide, which is otherwise known as Ozempic, or tirzepatide or Mounjaro, and others are coming. So the absolute indication is if you have a BMI above 30, or if you have a BMI above 27, with other conditions. And these other conditions are like high blood pressure, diabetes, heart disease. So that is the indication. So if you come to me and your BMI is around 25, I probably will not recommend the medication, because you don't meet that criteria. But if your BMI is above 30, then you're indicated to getting on these GLP-1s. But of note is, we don't do that in isolation. Exercise, nutrition has to go fast. And so when you come in, I'll be like,
Oh,
what
has to
have
go
you-
fast.
Has to go fast
Okay.
in the sense that
Yeah.
we do optimized nutrition, we do optimized exercise. We're able to track and see what can your body do with just intensive lifestyle.
Okay.
And then after that, after a month, then you come in and we see, then we're like, okay, can we attempt this tool? So GLP-1s or any other medications are just a tool to help you, because then even after we are done, the lifestyle is what really maintains.
Yeah. Okay. And what does being done look like? Is it 2 years? Is it 1 year? What does that look like?
So it's very individualized. So you'd come in and you do your analysis. That's like a body composition analysis. And we'd also just check your BMI and calculate what's your ideal body weight. And so we're able to calculate. So for example, you're 100, your ideal body weight is around 75. So we know we have 25 kilograms to lose. And so we are able to anticipate with this medication, you'll probably lose around 3 to 5 kgs a month. So that will approximately take you around 5 to 8 months. And so at the point where we get to our target, then we start tapering down. Okay. If we were at the high dose, then we start coming down to a minimum dose and we're able to observe and see. So there are two classes of patients. Some who we've been able to get off after they reach their ideal body weight. And some who we've had to microdose, meaning that now we give you small doses of GLP-1s, basically a minimum dose, to just maintain you to the limit. Remember, it's a disease. It's just like when you take high blood pressure medication, you don't get off just because your BPs are good. So now we say probably you'll remain on a small dose of the same.
Okay.
So the two classes, the patients who tell you, you know what, my lifestyle can sustain this, and we're like, good, let's continue. Because lifestyle, nutrition and exercise is still a medication or it's still a form of therapy. Yeah.
Oh, that's interesting.
That's interesting. Yeah.
Yeah. I didn't know there are people who actually remain on like small
Yeah.
doses. I thought you like stop completely.
So patients who are on GLP-1s because of diabetes, remember it was initially
yes,
a diabetes
yes.
medication.
Yeah.
So diabetes and obesity. So those patients we maintain on a small dose,
Okay.
mostly for diabetes management, but they also have a bit of weight benefit.
Okay.
Yeah.
So Lulu umesikia?
Me, I'm even surprised. It's the first person, other than, because not person, but a medical practitioner, because most of them we hear from the patients. They're called patients. Yeah. When they take them, they're like, it's good for me. And the doctors, even the gym guys, are usually say it's not something that you should be doing. So this, now hearing from you, I'm like, maybe I need to look for money and look for her.
Or money needs to find you.
It will find me.
It will find
Then
you.
I find her.
Yeah.
Then we are fine.
I know we were talking, and I
Yeah.
think you mentioned you've had some hormonal conditions. Now, what are some of the conditions you've had?
Had
Or
or
have.
have.
Or have. Yeah,
Have. What
yeah.
I know is the PCOS. That one is, that's the one that at least I've tested, and I know these other ones I'll just ekelea myself, but I'll just say the PCOS, which I think is also it just affects you in so many ways. Sometimes I didn't know, even actually the person who made me realize is Ndenya, when I was in the program with her, and she'd tell me, with PCOS, you need to do this, and I was like, I thought it's just like a period thing. Like once my periods are done, I mean, yeah. So that's the only hormonal that I know. Is it hormonal?
It is hormonal.
Okay, that's the only one. I'm learning.
Yeah. And I know she did mention it in like some of the conditions. That's why I wanted to bring it up.
Yes.
Are there patients that you see that have PCOS, and how do you handle that?
So yes, so I'm a hormonal specialist. So
First of all, tell us what that is.
So I keep saying it. So an endocrinologist deals with all the hormones in the body. So we have over 50 hormones.
Yeah.
So people know estrogen and testosterone, but we also have thyroid, we have insulin. And so just picking it up from PCOS, that's polycystic ovarian syndrome, is where you have insulin resistance just based on just the polycystic ovaries or follicles that you get. And so why you'd actually now get weight gain, or you're predisposed to getting weight gain, is because of the insulin resistance that comes about just by the fact that you have PCOS. But also one of the hormones that goes up is testosterone. That's a male hormone as compared to the estrogen, which is the female hormone. Okay, so there is like an about turn or mismatch of the hormones that are supposed to be there. So yes, so we manage PCOS. We understand that patients who have PCOS or PCOD, not the disease, are predisposed to getting obesity and weight. And so we are able to tell you, you know what, lifestyle comes first in terms of nutrition, in terms of exercise, because exercise helps with insulin sensitivity.
Yeah.
But also, then if the overweight and obesity comes, then there is treatment for that. And one of the things I have to mention, patients with PCOS mainly deal with is infertility and or difficult conception. And what we found is that this medication, just because you lose weight,
Yeah.
then you're predisposed to getting, babies. And so you'll hear Ozempic babies, people who
Is that a thing?
it is a thing.
Yeah, I had that. Okay,
Yeah.
okay.
So people who probably had been either primary infertility, meaning they have never gotten a baby, or secondary infertility, meaning they've gotten but they've really delayed, and you just lose weight with medication or lifestyle, and then now you become more fertile, and you get a baby. Yeah. And so for anyone on GLP-1s, point to note, if you're not looking to getting pregnant, please be on a contraceptive method.
Yeah.
And preferably a non-hormonal contraceptive method, because then there's also bound to fail.
Yeah.
Yeah. So we've had a lot of patients who've been on that.
Okay.
Yeah.
Now you mentioned something that I think many people don't look out for, and we'll talk about it in another episode.
Yes.
Lily, have you ever had your thyroid tested?
Yeah.
Okay.
I did once.
Why are you saying it like that?
Because that's such a scary thing.
Wait, why is it
Because
scary?
I think it's because I have an auntie who has a problem with the thyroid, that she has Yoshida. And it's always like such a struggle, like so many medications, and then it has more effects like to the body. Even actually she gained weight. I don't know if it's because of that. Like it's just insomnia usually fear it so much. That's what I've said. Because when the doctor told me to test, I was like, guy, your doctor tells you to test. I'm like, why? Is there a sign? But
Okay, that's interesting, because there are many women who actually might not know that they have a thyroid issue that they probably need to look out for, and that might be the cause of their weight gain or being small.
Yeah.
Because it can either be both ways. Yeah, so we're going to talk about that in another episode, so you'll stick around and watch that one as well.
Maybe even I'll be here.
Now, Doc, what are some of the side effects of Ozempic and the GLP-1s?
Okay, so the immediate side effects are nausea. So just by the way it works, one, it works at the brain center to decrease your appetite, increase your fullness or satiety, but also it works at your gut by slowing down the food. So in a sense, because it works at the brain center, causes nausea, causes a bit of headache, causes a lot of fatigue. Then in the gut, it slows down the movement of food, so there is constipation, you can have a bit of bloating. Sulfur bumps, most people will tell you that is quite big with the GLP-1s. The common and rare side effects, one is acute pancreatitis, or the feared side effects, let's say that. And that's because it also acts at the pancreas by telling the pancreas produce insulin. That's why it's used for patients with diabetes. And so if you take alcohol, especially heavy alcohol use while on this medication, you are at a risk of developing pancreatitis or gallbladder disease or gallstones. Okay. I want to mention, if you have anyone in your family with a history of thyroid cancer, we wouldn't give this medication because of the risk of thyroid cancer in rodents, but then you don't want to test, in humans. And also there has been a whole discussion about blindness. I have to mention that this is only common in patients with severe diabetes eye disease. And so anyone with diabetes, before you put on this medication, you have to have an eye review to see how bad or not the eyes are. So in summary, very safe medication by the fact that it's FDA approved, but then you need to be aware of these side effects.
I didn't know about the blindness. Okay, that's a new one.
It's interesting. It's in literature, we have to tell you when you're coming in, but we haven't seen that actually in our setting.
And we don't want to see it?
And we don't want to see it for sure.
We don't want to see it.
But just have an eye review, especially if you have diabetes, before getting on this medication.
Okay. Now, Aiysha, Lily, what are some of the things that scare you about weight loss in terms of medication?
I think because this is based on anything that I see and hear on social media. Disclaimer. I've not read anything. I've not talked to any doctor. This is my first time. So just what I hear is the relapse is crazy. Like if I stop, though you're saying, you can reduce the dose and then someone can just stop. Then when you stop, your weight can get back like times 2. That's one thing I feel, because We don't want that. Also just the fact that it's something new being introduced to your body, you know, anything that comes, even this, they were talking about the other day, even an antibiotic that comes to your body, things just change, you know.
Yeah.
So those are the fears that I have. Yeah, I don't think I have any other crazy fear. But
The relapse. How often do you see the relapse, and what does it look like?
So, and this is based on studies that if you get off, you are at a risk of gaining back at least 0.5 to 1 kg per month, especially if you don't keep up with the lifestyle. And most patients have been found that after 2 years, you gain back the weight again. Okay. And so with that, before we were like, let's cut off, you know, stop, go and do your exercise. But now we've realized, because this is relapsing disease, the body always wants to go back to its original state. Then we keep you on very small doses in a sense. How often have we seen that? Not too often. And this is because we are very big on lifestyle intervention first before getting onto the medication. Yeah, in terms of nutrition, in terms of exercise, keep up your protein intake, you know, and there are calculations that we do. Keep up your vegetable intake, reduce your starch, because really weight loss is a factor of decreased calorie intake and increased energy expenditure. Okay, so if we maintain that, even after we get off the medication or we reduce the medication to a minimum, then you still keep the weight off. But if, you know, you continue, you know, you go back to, you know, with no lifestyle, you know, maintenance, the weight will surely come back. And so this is just not, the medication, we say it's a tool, but really you still have to put in the work and do the work. Yeah.
So Lily, what are you doing now? Right now, before the money comes. Before the money comes, what are you
eating
doing?
boiled foods anyway.
No, I don't do boiled foods.
Like, I'm really trying to reduce by the and this is all because I saw it work. So I reduce on, I'm a lover of bread, chapati. Those are the two things by the me sijui ugali, mchele, I can do without.
Imagine ugali is yummy.
I can do without.
Have you reached in adulthood where ugali is yummy?
It's yummy, but I can do without it. Like if you tell me you can have sijui, that's fine. But bread and chapo, those things and chips used to nini. But after I got sick, I've not eaten a lot of fries. Actually, I think I've eaten fries once because I'm just scared of getting back to being sick. So what have you asked me?
What are you doing?
Or what am I doing? Yeah, I'm really trying to work on what I eat, because I know solely, even if I do any the Monjaros and the Ozempics, even if I go to the gym, I'm not eating right for sure, it won't work. So I really try and do that. Yeah, but also I go to the gym once in a while. I still walk. I swim.
Oh, really? Because you know, swimming is such a good activity because all your muscles are working.
Yeah, but now you see, that's what I was telling you guys. Like, especially last year, from January to about June, I did so many things and I knew this was going to work. Girls, all worked, is just that I lost the water weight for the pregnancy, which was about, like, I think I lost like 11 kgs in total. But now I went back to the weight that I was before pregnancy, and I tell you, I've never gone higher or lower than that. It just maintains. So that's why I keep wondering. Sometimes I sit down, I'm like, so I just sit down.
Okay. But now today you've met Dr. Carol.
And I'm just happy. Now you can tell me about this situation of mine.
So what else can she add to her? She's working out, is there?
I mean, it's
diet?
not as much.
Okay, no, you can optimize it. But is there anything else that maybe we need to factor in when we're talking about lifestyle?
So let's start with food parts, nutrition. So we want you to maintain at least 1 gram per kg of protein. And this is the reason. Now, even the American guidelines have changed that to 1.6 to 1.8 grams of protein per kg, which is big. So say, for example, I don't know if you want to say your weight, then we're able to calculate. You don't want to say, okay, so let's approximate 70 kgs. So that will mean that.
But yeah, that's the standard measure we use in med school, 70 kg man, woman. Yeah.
So that means that you need at least 70 to 100 grams of protein. And how you calculate that is, what are you having for breakfast? Say you do 3 boiled eggs, egg whites, that's 20 grams. So we're able to calculate. And so really up your protein intake. And protein does 2 things. As you lose weight, you lose fat. We don't want you to lose muscle. Okay, we actually want muscle to replace. Protein also keeps you fuller for longer. But there's something called NEAT, non-exercise thermogenesis, meaning even when you're not exercising, by the fact that you ate protein, then you burn actually extra calories. Okay, so the first thing in your diet is, how much protein am I eating? Second thing, each meal you eat has to have vegetables. Okay, and that's fiber just because it keeps you fuller for longer, the digestion gets better. Our culprit is actually starch and sugar, and it's sugar in any form. So it can be sugar in fruits, sugar in honey, whatever sugar. So you have to just identify, just because extra sugar is converted to fat. That's how it's stored in our body. Okay, and so the first thing is, if you do that, cut out your sugars, carbs, do more protein, more veggies, good. Then exercise, increased energy expenditure. And now we want not only aerobic cardio, now we also want strength training, a bit of strength training. And so I'm happy you do swimming, which is good aerobic cardio. But then you'd want to, if you do your walks, maybe just include some dumbbells to build, a bit of resistance training, get your ankle weights, do some squats. And I usually say every time you go to the bathroom, just do 10 squats,
Fall, Dr.
You will not fall.
In the bathroom. Hey.
Okay, whatever form of strength training you do. And interesting, if you miss 48 hours without exercise, so it said that whatever you did before really doesn't make sense. So make sure you just do at least alternate day, if not every day, exercises. And here's the secret: if you want fast shredding and losing weight, you really have to increase your HIIT workouts, like aerobic. Like now you're doing the walks, which is good. Maybe introduce a bit of jogs intermittent to the walks. But well done for trying. So keep at it, even though you don't see change. Imagine something is happening in the fat organ or the adipose tissue. So even though you don't see change out, just keep at it.
I think I'll need to go back to the gym, because our gym was so nice with the aerobics. We had classes, so we had some stick exercises. That was very no, as in stick, like unatumia kijiti kufanya hivi, sijui inaitangwa aje hiyo kitu.
Yeah, that's good because it works on your core.
Yeah, it was actually, it was, I think, you know what, I'm going back to the gym.
Yeah, please do.
Oh,
yeah.
Thank you. I think we've brought back one soul to the gym. But even sleep, I think people underestimate the power of sleep. Oh, are you sleeping well?
But actually, the thing is, it's nice you've brought that up. When I'm not eating right or doing anything, I really suffer from insomnia. I don't sleep. But the days I know I've walked, I've swum, and I know for real today I've eaten very well, I will sleep so well. Like, it's so interesting.
Yeah.
Right.
I don't know if that's medical, it's just in my head.
No. It's actually, sleep is one of the 4 pillars of obesity or weight management.
Yeah.
Nutrition, exercise, behavioral modification. And here we have sleep and stress, because those also influence our weight. And so sleep, we usually say at least 6 to 7 uninterrupted hours of sleep. And that's because if you don't sleep, one hormone called cortisol goes up. Okay, cortisol is what rises, makes us, keep awake. And so when cortisol rises, it mops up glucose and tends to now retain weight. So that's why for us, sleep, if you don't sleep, you're just like, you won't lose weight. So let's get our sleep in track. And then chronic stress has actually been shown still the same thing, increases our cortisol and tends to gain weight, especially around the abdomen area. So we're very keen to see that. So so your observation is true. Well done, Leila.
Actually,
that,
the fact that she said stress, it's so interesting, because there's a time a doctor who's also a friend told me that, and I just said, you just don't want me to have stress. I think that's what you're just telling me, to square a stress, Aiysha. But the fact that you said it and you don't know me, then it's right. I will reduce my stress. Eric, stop stressing me.
Unprovoked. All right. I know it's a conversation that can go on for long and long. This was just the introduction. Maybe to wrap it up, because I think weight is such a contentious topic, especially for women. What are some of the things we miss when we just say we're trying to lose weight, but maybe it's a health condition, maybe you're not sleeping well, you're on medication? What are some of the things that we need to consider before we just decide, let's use this avenue to lose weight? Yeah.
So the first thing is, overweight and obesity can be because of medical conditions, like you've said, and we always have to rule those out before we say that it's lifestyle. First thing, like you said, hypothyroidism, low thyroid hormones. So we always do a thyroid function test before. PCOS, we know it's associated. Other conditions like just infertility, and even for both male and female, something we call hypogonadism, just you're not producing enough hormones, either testosterone or estrogen, that can cause you to just be overweight. Other genetic conditions are people who will tell you, all of us in our family are big, and that's genes. But then even with the genes, there's usually what we call an environmental trigger, something that triggered, not for you to start producing that. The other thing that you need to know is treatment of obesity. Like I said, 4 pillars always starts on your plate. 60% is actually nutrition, but now it's no longer eat less. It's what are you eating, okay? And especially if you're on GLP-1s, we found that people are sub-eating, especially protein. And so you get like these Ozempic faces. You've seen that because you've lost so much muscle around your face.
Yeah.
So you really have to up your protein. Exercise, like we said, every single day, and I say at least 5 days a week, both strength and cardio, aerobic, and then sleep, stress, and then if indicated, then GLP-1s are here to save us, I have to say.
Yeah. I think something else we also need to remember is sometimes it can be the medication you're on.
Yes, very important.
Yeah, like antidepressants,
Yes.
birth control. Yeah, so these are some questions to ask your doctor. If you put on any medication, what are some of the side effects? Not just for weight gain or weight loss, but what are some of the side effects that I should be aware of? What else? Of course, there's pregnancy, but just certain states and medications can contribute to your weight management. So the solution is always make sure you're focusing on the cause of the weight gain so that you're not shooting blindly. Because, you can be on GLP-1 thinking you're losing weight, but once you stop, you didn't address the main problem.
Agreed. Very important.
Okay. All right. So now, because we want to just end nicely, I have a segment called Beyond the Clinic. Both of you can answer. But Lily, you've answered now.
Which one? Maybe I have a different
Maybe you have a
answer.
different answer. Okay, sawa. So we're stepping outside the clinic. This has been lovely. Now just think outside
Life.
the clinic. Think life, yeah. Okay, question number 1. What's one health rule you think we should all break more often without feeling guilty?
One health rule. You want to go first?
I think I said drinking water
You
last
said
time.
drinking
Yeah,
water. You
I
had to
still feel the
maintain
same.
So one health rule that
We should break without feeling guilty at least once or twice. Or rather, every now and then.
interesting. I'm a stickler for health rules, so I don't know which one you should
You have
break.
to break at some point.
I usually say, well, they say don't have a cheat day. I usually say have one cheat day.
Who says don't have a cheat day?
Yeah, well, I mean, if you come to me, it's like don't have a cheat day.
That's so impractical.
You know,
Yeah.
but have one thing that you look forward to eating or having once a week. And that's because we're no longer doing a restrictive diet, because then you'll be miserable. And also because we also see children, that's the pediatric obesity. We always say, let them have one treat in a week, so that they look forward to eat. So for me, it's whatever you like doing, do it once a week.
Okay. Once a week. Yeah, that's
Once a
as
week.
frequent as I love.
That's manageable.
Cynthia? Yeah. Okay, next question. No, let me not just say that one now. Is there something that you find being so wild that the body does? Like maybe you're just like, the body was so wild for doing that.
PMS. You know, those premenstrual
So
syndrome.
wild.
Where
It's
do we even
like,
start?
as in,
Yeah. Like period's already enough.
Honestly.
And then now you're meant to be upset for nothing.
I'm just like, please.
Yeah.
And I usually say probably men and may not understand. Like I'm so happy and then I'm moody all of a sudden, or or I'm emotional, and honestly we can't control it. And then some fatigue and some
Not some
this
fatigue,
body
a
A lot. You just want to sleep.
A lot of fatigue.
Yeah, so for me it's
That's
anyway.
a good one. Yeah, that's a good one. All right, next question is, what's one thing you do for yourself, either in the morning or in the evening, that's just for your sanity?
So 2 things.
Hey, she said not one, but 2.
I know 2 things. 2 things. I think my quiet time, that's prayer time, very key, and my exercise, very key.
Are you a morning or
Oh,
night?
morning.
Okay.
I'd be awake by 4 a.m. You know, yeah.
You guys team 5 a.m. team 4 a.m.
I know.
What's the problem?
No, it's also because that's the only time you have in your day before the house wakes up and you're no longer. Yeah. So I mean,
She's a mommy.
Yeah.
Mamacita.
Honestly, 4 it is. 4 it is.
Yes.
Okay, then the last question is, what's one actionable health tip you would send to your patients right now? Just one.
Nutrition wise and movement.
Okay.
Protein, vegetables, and movement.
Okay.
Yeah.
Sounds
I'm very big on lifestyle.
Yeah.
I mean, the medication is just a tool, lifestyle, and we all struggle
That's
with
true.
the it, but nutrition and movement.
Yeah. And I think lifestyle medicine is becoming more of a thing in Kenya. So hopefully it'll become the norm.
Yes.
Yeah.
Yeah.
All right, guys. Thank you so much for honoring the invite. Now, I just want you guys to plug yourselves. If you want to be found, if you don't want to be found, do you?
You know where to find me, my honeys. Lily Aiysha everywhere. Instagram, TikTok. That's where I'm at. That's it. Wow.
That's it.
That's it.
Okay.
Yeah. Oh, Lily Pit Blooms.
I was
If you want
waiting.
flowers.
I was like, you want me to remind you a third time?
I'm sorry. I always forget that part. If you want flowers, please.
Yeah.
Yeah.
Okay.
Lily Pit Blooms.
Sawa, sawa. We'll put it down there.
Thanks.
What about you, Doc?
Dr. Caroline Mithi on Instagram, Facebook, TikTok, and Evolve Well Healthcare, who is my baby, but such a beautiful wellness center. So on all other socials, Evolve Well Healthcare.
All right. We'll put both of them down here. Now, unless there's a parting shot. Is there a parting shot?
Let's go back to the gym.
Say it louder. You don't sound very
Let's go back to the gym, my honeys. Let's walk. Let's check your plates. Now I've learned a lot. Like, there are things you just do at, nakula protein, but you have to, like you've said, measuring. I didn't know, like in a day, I have to eat this, It's actually the most important thing is just visit these guys first, get to learn everything that you need to know about your body. Then now you start. Just start at it.
Yeah.
For
Knowledge
the
is
gram.
power.
Yeah.
No, the more you know, the more you're able to do.
Yeah, that's my parting shot. Dr. Lily.
Sorry for stealing it. That's Dr. Lily.
Dr. Lily.
Doc, do you have anything?
If you're going to get started on a GLP-1, do it the right way. Go to a healthcare provider, whoever really. Have your tests done prior, have a good body analysis prior, and then have monthly follow-ups while on these medications. And the most important part is after the treatment, then what? That is the question you should always expect.
Okay.
Yes.
Important. Yeah, then what?
Then what?
All right, guys, that was it. Thank you so much for joining this conversation. If you've reached here by now, please, I'll just give you 1 second. Actually, maybe 3. I'll be nice. To subscribe, please just click the button. Please subscribe. Follow us on our socials, which is Instagram, TikTok. I always forget to plug myself. So follow me, Dr. Hope, on my socials as well. We'll put everything down here. And that's a wrap.
Yay!
Thank you for having me.